82% in the form of uh, physical, verbal, or sexual. Among that, the verbal abuse was the most common, comprising about 31 to 96%. Next comes the physical abuse. Physical abuse ranges from 2.3% to 36.8%. Then comes the sexual harassment, 0.7% to 21.8%. So patients and their families were the most commonly reported perpetrators of verbal and physical abuse, while co-workers and patients were the most commonly reported perpetrator of sexual harassment. Obviously, if the workplace is not optimal, it will definitely reduce the productivity of any institute. And in turn, what happens is this all will affect individually as well. It can lead to anxiety, stress, burnout, and depression. Yes, I have some issue in moving the slide. My apology for the interruption. So our question is how we can manage the workplace violence. So here comes the importance of nurse managers. They should act as a liaison agents with the organization for formulating and implementing workplace violence prevention strategies, including like internal grievance cells or internal complaints committees for addressing those issues, and skill-based training programs demonstrating appropriate techniques of communication and aggression management. So we as a healthcare professionals, while dealing with the public, will and especially while dealing in the patients in emergencies and the bystanders, it's often difficult. So skill-based training is necessary. Apart from that, attention should be given to novice and young nurses who are at higher risk of experience workplace violence. This is commonly seen in the critical areas as well as in emergencies, and also even in psychiatric wards. So when a new employees join during the induction program, this also has to be uh, trained for this novice and young nurses, and appropriate measures to sensitize nurses to report workplace violence. That is also very important. Sometimes uh, playing a victim role is makes the victim more pressurized. So the appropriate term is not victim, it can you can call as a survivors. I mean, there should be an efficient system in, there will be hierarchical positions whom they can contact at every phases if any workplace violence happens, and a zero tolerance policy on workplace violence. If any mishappenings happen, then there should be stringent actions to counteract. And next, the common problem in workplace is burnout. Burnout, that is because of the nurses have been stressed a lot beyond their capacities in delivering an optimum professional care. It includes emotional exhaustion. That means uh, the the nurse will be emotionally exhausted because of the workload, because of the violence, or because of the scarcity in the resources, or all because of the communication problems existing in the department. All these can contribute. And depersonalization means, that means it can affect the even the personality of the professionals, because being a professional, it affects their mental, physical, and social and familiar well-being, and they feel like they are not accomplishing their personal and professional milestones. Obviously, the cause for this burnouts are long working hours, experiencing a major stress at work, not having the right team to work with, lack of autonomy at work, and negative psychosocial environments. Burnout has been found to be associated with absenteeism, high turnover rates, low morale, and decrease in the quality of care. Uh, I think this is an issue, so we need to tackle it effectively. So managing burnout, since the person has to take a lot of efforts to come out of it. That means need to set boundaries, where to draw a line, and processing your emotions. That means sometimes there are a lot of emotional turbulence happening because of the work pressure, because of the family matter. So taking one at a time and expressing and ventilating the feelings towards your colleagues, towards your supervisors, or to your higher authority. And even WHO has told during the COVID times that buddy system. That means there should be an effective system among your buddies to ventilate your feelings, share your problems, help each other to tackle this burnout. And putting yourself first is also very important. Sometimes, being a healthcare professional, we are there for the patients. We take care of the patient. We deliver quality patient care. We carried out all the I mean uh, requirements required for the patients. So managing yourself is also very important. Spend time for yourself. Practice yoga and do some activity which really excite you. It can be like watching a movie or going for a shopping, and means whichever means that i mean helps you out to chill. That will really help. And managing your stress. And when if you want to manage your stress, you should identify what are the stresses. That means what are the factors which causes stress in your day-to-day life. So you should differentiate whether it is because of personal problem, or it because of a workplace issue, or it because of a social issue, or because of a mental problem. So you need to see what is the root cause, and you can involve in stress reduction activities like yoga, pranayamas, doing some physical activities. So it will definitely help. And find solace in creativity. So definitely human beings are really creative. So all are creative in their own aspect. So you should find uh, your skills tapped uh, to manage these kind of burnouts. And the third problem is work environment and job satisfaction. There are certain factors which can which can hinder the satisfaction among the nursing professionals. This can be night shifts and factors associated with low level of satisfaction, where inadequate staffing, inadequate equipment for protection from hazards. Especially during COVID pandemic, during the initial phases, there are scarcity of personal protective equipment put them in some kind of job satisfaction. And this kind of job dissatisfaction is associated with absenteeism and higher employer turnover rates. So this is an indicator for the management or the administrator, that if there is a lot of absenteeism and if there is employer turnover rates higher, there is some kind of things that you need to make the employer satisfied, like giving some appreciation during the important events like nurses day, or going for a picnic, or celebrating the birthdays. So this kind of small things definitely encourages the professionals, and they may satisfy with their work. And especially, I also want to quote the study conducted by Wagis et al. This is also a meta-analysis published in the Journal of Global Health. And especially during COVID-19 pandemic, uh, globally, nurses had reported almost 32% had reported anxiety, 40% had reported stress. Depression was found in 32%, PTSD, that is post-traumatic stress disorder, almost 19%, and insomnia, that is sleeplessness, comprises of almost 38.3 percentage. So there are severe mental issues happened during COVID-19. This is a meta-analysis, recent meta-analysis published. So this is a global, global data. That means they have compiled the data for during this time around the globe. And the risk factors found out that the caring of COVID-19 patients, being a female, low self-efficacy, resilience, social support, and having physical symptoms, sore throat, breathlessness, cough, lethargy, myalgia, and fever. So I have discussed about the, workplace violence, burnouts, then job dissatisfaction, and COVID-19 and mental health. So when you're considering the general management of mental health issues, the focus should be on three thrust areas. Number one is person directed. Number two is organizational directed, and number three is campaigned. That means a combination of both person directed and the organizational directed. So person directed includes adaptive skill training. That is why I told you when a new staff is joining, you need to train the staff for all the skills and also for the specific mental health issues, like reporting the mental health issues. Making them assertive to report and assertive to, tackle those issues from a personal point of view, and communicative skill training. And especially when you're dealing with patients in an emergency setting or bystanders in an emergency setting, you know, there is often a lot of communicative problems happens. Sometimes a patient may be rude, and you need to find ways to be assertive. At the same time, you need to set boundaries so that the communication can be much more effective and there is no harm being done. And social support is also an important factor. Uh, that means, especially during the COVID-19 pandemic, nurses had got a good amount of social support considering the services rendered to the society, and exercise for relaxation. So employees need some kind of exercise. It can be, planned in between the shift, because in many of the institute there are, specific cells like yoga centers or relaxation centers for that. And sometimes, there are certain, professionals who needs some kind of counseling. So that is also, very helpful. So the mental health care professional will deal those four problems. And if there is severe mental health issues, you can always uh, go to a mental health professional for a psychotherapy. And organizational directed includes trained supervisors and managers for effectively dealing with the patients, because the supervisors and managers should, I mean, understand the issues of the colleagues and their subordinates, what actually is happening, and there should be effective communication, within the subordinates and the supervisors and managers. At the same time to time reporting. And I also told about the buddy system, so that the issue can be solved then and there itself, uh, and it can be effectively managed, and change organizational practices if necessary, and introducing vacation. Uh, Obviously, being a professional, we all are persons, we have family life, we have personal life. So there should be an optimum balance between each and everything to perform, very good or very well for the institute. And in between, you can have refreshing retreat in important days like Foundations Days or Nurses International Day, Nurses Day, and all other important days. And when I talk about job dissatisfaction, some of the employees really wanted to learn. They wanted to have higher studies. So the administrator should give permission. For this kind of higher studies, which in turn will benefit, as a person and also as an organization, their skills can be utilized accordingly. And performance appraisal. That is very important, because if the employees are not recognized for their work, then the motivation will go. So the external motivation is also equally important, like an internal motivation. Like recognition, the same of, the simple way as like, giving away certificates, appreciating the work, the best employee of the month, uh, such kind of things can be very much effective in bringing the the healthcare professional, especially nurses, morale, and in turn it will improve the institutional productivity. Conclusion. As a conclusion, India has always provided competent and professional nurses who provide compassionate care across the globe. And tomorrow is our International Nurses Day, and It's our day, and you need to take the time every day to love yourself. You deserve it. As a take-home message, I wanted to tell you 5 daily reminders, 5 positive affirmation you can practice. You should be telling to yourself every day that I am amazing. I can do anything. Positivity is a choice. I celebrate my individuality. I am prepared to succeed. With that, I am ending my presentations. Once again, thanks a lot for giving me such a wonderful opportunity to present the topic on occupational hazards and mental health. Thanks a lot. Thank you.
Thank you so much, Mr. Jitin Thomas Parel, for emphasizing on the mental health hazards and the management of the same to all of us. Thank you so much. Nurses provide care in all areas of the hospital, hence are more prone to different injuries and safety hazards. Here now, discussing with us the topic, occupational health of nurse, chemical injuries, including chemotherapeutic injuries. For this, the moderator would be same. That is, I would request Mrs. Shabana Khatun, ma'am, Principal College of Nursing, SGPGIMS, to stay along with us. And to present the topic, I would call upon Mrs. Anjali Devi, in charge in service education, AIMS, New Delhi.
Thank you so much. And good morning to all. First of all, I would like to thank the organizers who took the topic. Most of the time, this topic or a neglected topic, but you took this topic as in AIMS New Delhi. I'm working as a nursing officer. Talk about just a small talk regarding occupational health of nurses. Is my slides are visible? I'm sharing my screen. Yeah, I hope that is visible to all of you.
Now it is visible.
And make it full screen.
Yes, it's visible to all.
It's visible. It's visible and
I said also. Shall I start? Or
मैम F5 प्रेस कर दीजिए.
ma'am, can you press F5 so it will be in slideshow?
it's in a slideshow only now. Yeah, in my monitor, it's in a slideshow only. F5 also I pressed. Maybe your device is.
Okay, so you can proceed your topic.
Yeah, I can proceed. Okay. Because in my monitor, it's in a slideshow only. So chemical hazards, today we are going to talk about chemical hazards. Okay. Yeah, it's injuries, chemotherapeutic injuries are at most causes one in which every day the nurses are facing, especially oncology nurses. So today we are going to discuss about that. And first, before dealing with the chemotherapeutic injuries, let me move on to the chemical injuries, which is common for not only the oncology nurses. Every nurse, day by day, they are facing a lot of hazards in healthcare. Chemical injuries are common. So nurses continue to report high levels of job-related injuries and illness. This whatever stated here is depend on that studies mentioned here. Is it okay?
Yes.
We are playing the slides from here. You can say next.
Okay.
This
Yes,
is
ma'am?
Anshri Devi. We will operate
Yes.
the slide from here. You can just speak about the topic.
Yeah,
Is
no,
it
no
okay?
problem. If you feel difficulty, yes, it okay, no problem. So shall I close from my side?
Yes, you can close from there.
Just a minute, this will stop. Yeah, I'm closing from my side, okay?
Yes.
Yeah. So now you can.
Are you able to see slides?
Ma'am, you
No,
able to
it's
see
not
the slide?
operable because. Yes, I'm able to. Just a minute. The introduction slide is shown, isn't it? Can you show the
Yes.
previous one because I'm not able to. Can you show the previous? Yeah, now it's moving, and yeah, I'm able to see the slides. Yeah, thank
Okay,
you.
ma'am.
And can you bring it to the introduction, first slide? Yeah, thank you. So nurses continue to report high levels of job-related injuries and illnesses because the working environment, the responsibilities, what we are having towards the duties, and of course we are the frontliners in every activities of healthcare sector. So because of that, nurses are the main people who is going to affected with the occupational hazards. Okay, so among this, of course, along with the nurses, other healthcare workers also is going to be suffered or suffering now. But nurses are the frontliners. Because of that, we are facing a lot of difficulties in the healthcare sectors than the other people. And apart from this, disinfectants, sterility products, whatever the gases, medications we are daily basis we are using in the hospital sector, that is the most important common cause for the nurses to be injured while doing the workplace. Okay, next slide, please, ma'am. Most studies have reported an increase in the risk of spontaneous abortion, especially for the female nurses. And and apart from that, the works of exposed men, it is proven by the studies. So it's a logical factor that every nurse should protect themselves before entering into the hazards, okay, or before handling into the hazardous drugs. So nurses with decades of exposure may be at a risk of central nervous system, that is, either it is a perceptual or a cognitive or motor impairments, whatever it is, but they are going to lose the permanent damage. And currently available technologies, somehow we can reduce the complications or the risk when we are comparing with the 2 or 3 decades before, how the nurses were suffered with the occupational hazards. But now we are not, a little bit we are upward, and technological involvement is there ourselves with the protective equipments. Next slide, please. Next slide, please. Yeah, thank you.
Change the.
So first we can move on to the chemical hazards, then we can move on to the neoplastic drugs hazards. Okay. So chemical hazards exposure to anesthetic drugs such as nitrous oxide, halogen, ethylene bromide, ethyl chloride, ether, methoxyfluorine, still lots of gases or medications everyday basis we are exposing, especially operation theater nurses and ICU nurses are those who are in the critical areas are facing a lot of difficulties whenever they are handling these type of anesthetic drugs, and which may cause not only the skin injuries, eyes, nose, and throat also is going to be affected because of droplets or aerosols. And apart from that, if they are suffered with chronic, the same area they are working chronically, like one nurse is in the operation theater itself for a long time period, a decade or 2 decades. So due to chronic exposure, they may have, there are a lot of occupational hazards, but they want to work in that particular area itself. So such kind of nurses are also available in our setup. And apart from that, those who were feel themselves that they have to protect themselves and they are trying to move to some other areas. And so there are staff suppling is going on in yearly basis. So chronic poisoning is the one of the major role which give the reproductive instability, or most of the nurses are suffering with the reproductive problems. Okay, and apart from that, latex allergy, maybe due to natural latex gloves, but nowadays is there are options, powdered, non-powdered, and advanced gloves technologies are available. So whatever is available advancedly, that only we are able to use than the previous one. Okay, then chemical risk is due to the action of various substances like from the cleaning agents to sterilizing agents. We are facing a lot of injuries everyday basis from minor to major. Next slide, please. Yeah, this is some of the pics I included here. Those who suffered with the eye injuries, those who suffered with the skin damages. And now you see that there are a lot of injuries taking place, maybe due to complete exposure of the whole body, and due to clouds or fire, chemical injuries. So there are a lot of problems every day the nurses are facing. So some of the slides I shown here. Next slide, please. There are some types of chemical hazards. First and foremost, dermal risk, that is the injury to the skin. So this is because we know that it may be either direct contact or indirect contact, but most probably our skin is directly exposed to the chemical hazards, especially splashing agents. So if that particular staff doesn't wear the protective equipments properly, because most of the time what happened, suppose if they are wearing the only gown, sometimes they left the mask or they opened the mask, sometimes there may not be the proper clothing, or may not covered the head, and swoop over may not be there. So like that improper technique, those who are following, they are going to face a lot of dermal risk. And apart from that, inhalation risk, of course, next to the dermal risk, inhalation risk is there, because we are in hospital setup, we all know that there are a lot of gaseous agents exposures are there. So because of that, inhalation risk also is there, even if you are wearing the normal 3-flame mask. So because of that, now this is the protocol after this pandemic, everywhere there are N95 masks they are using, which gives a lot of protection than the 3-flame mask. So it's advanced technology. Of course, it's cost effective, but we can protect our health by this way. And the next, fire and the risk of explosion. Here, because we are using a lot of chemicals, so inflammable products are there. But in this, if the labelings are proper and if it is handled in a proper way, we can avoid these type of fire injuries because of the inflammable products, or otherwise what we can do while preparing the drugs. Some drugs are non-inflammable if we are not mixing together. Whenever we are going for the mixing for some other work, so there may be the chance of firing. So because of that, before going for that, we have to notify the label, a date, and what type of product it is, and how much we have to be mixed for that particular task. So this is very, very important to avoid the fire risk. Next slide, please. Thank you. Chemical injuries, and apart from the sterilizing agents or anesthetic gases, the important exposure on everyday basis, we are facing the difficulties, especially operation theater nurses. That is the ethylene oxide. That is the it may comes in the radiation injuries also, but this I put in this chemical injuries because this is because of the ethylene oxide. Because ethylene oxide is the powerful alkylating agent which is using for the sterilizing the heat stable instruments. So here I showed this slide as the ETO machine, and the staff is going to insert the tray for the sterilizing purpose. So here they are if inappropriately those who are following the techniques, they are going to expose by the ethylene oxide, because ethylene oxide is the very it's like a carcinogenic, and immediately it may give the effect, and later effects also will be there because of this injury. So once the person is exposing for the long term, and because in our setup this is handled by the operation theater technician, but sometimes nurses also want to work with this machine, so that time we are exposing in such cases, emergency cases, or sometimes trays are not available, adequate things are not available. So immediately before the aeration time, we are trying to open the machines, automatically we are directly exposing with the ethylene gas. So because of that, nurses are more injurious to this type of chemical injuries. Next slide, please. And apart from this, next slide, please. So we in our setup we have a plasma also, but when we are comparing with the ethylene oxide ETO, plasma is will not give much injuries when comparing with that, and work with the plasma is very easy than the ETO. So whenever we are working with the ETO machine, we have to be very careful, and we have to use the protective equipments. So how we can protect? What are the steps are who all are the person involving to take the precautionary measures? Okay, so here of course there should be the cross ventilation. So if the cross ventilation is there and the ventilator setup is adequate in your hospital setup, there is no issues in that, even though if your aerosol is exit, or there should be the airflow here and there. If it is, then there are a low chance of chemical injuries. And individual self, every nurse or every healthcare worker must be protect themselves, because safety is the first and foremost for themselves than the care, next to the care. So before giving the care, first of all we have to protect ourselves. So most of the time nurses are neglecting to use the proper personal protective equipment. So PPE is the main which can protect every nurse. So here if one nurse who's using the PPE in a proper way, surely she or he can protect him or herself from the not only from the chemical hazards, from all types of hazards also. And organizational, what they can do organizationally, there should be the planning, implementation, evaluation process, all the protocols, everything they have to handle in a proper way. and risk assessment every year they have to do in organization setup, and that risk assessment, how much risk was that this year, how they are going to reduce in the next year, and what are the steps they are going to take for that risk assessment reduction, and how they are going to implement it, what type of evaluation procedures they are going to do. So these all those things done by the administration. Next slide, please. So once the administration work is proper, then automatically this message will be transferred to the healthcare workers, and they will be alarmed periodically so they can protect themselves. Okay, and apart from the organization, monitoring is a very, very important. From the lower level to higher level, we have to go for the monitoring and evaluation of the particular situation in an everyday basis, monthly basis, and yearly basis. So monitoring will be done by the from the low level supervisor to until the administration level. So when the proper supervision and monitoring is going on in every hospital setup, no nurses will be injured more, maybe less here and there is a common, but apart from that, the more number of nurses may not be suffered. They will be careful about themselves. And apart from this reviewing, of course, last year what they did, what was the mistake they found, what was the good thing they found, and the same they are going to implement it in the next year. And what was the mistake they found, how they are going to rectify it, that also they are going to do the planning, and what type of implementation they are going to do for that, and how they are going to evaluate it. Next slide, please. So this is up to the management, up to the individual, up to the everyone, from the lower to higher, everyone is responsible to reduce the chemical injury in the hospital setup. So I don't want to mean only the nurses, even the other technicians, those are doctors, those who are handling directly dealing with the drugs or the solutions, they also should be aware about themselves, how they can protect themselves. Okay, and some of the preventive measures are there, very simple preventive measures are there, that if we are following in a regular basis, surely we can avoid the chemical injuries as well as the neoplastic hazardous drug injuries also. So what we have to do, wear the shoe designed for the nurses, and should not be slip up, should not be high heel, or should not be designed. It should be comfortable for every nurses in that smooth workflow. And while handling the shop, they have to be very careful, and every nurse should be responsible for the biomedical waste, because these hazardous drugs comes under the toxic dustbin. So that separate bin will be there for that with the simple, so there only we have to be discarded. And safety instructions should be placed here and there everywhere, wherever the workstation is there, and periodically they have to inspect that particular area and the staff members, those who are working in that particular area. Apart from that, if there are the radiation workflow is there, especially in operation theater, there are on-table X-rays, MRI scan, and the CTs. So MRI, we don't want to do much because there are the red lines, so we should not cross the red line. But when we are, if the patient is undergoing on-table X-rays or a CT, then the nurse should wear the lead apron and the collar. So that, like that, there are some of the protective things are available that we have to use. So first and foremost is the safety is the first. Protect self, then only we can go for the care of the patients, and provide, once it occurred, any kind of the encountered like a splash or chemical touch, whatever it is, immediately it has to be washed with the running water. And if anyone who's facing the latex allergy, they have to be very cautious what type of gloves they have to be use. But nowadays, after the pandemic, we have the advanced cloud technology, but before that it was not. But at the same time, there are powdered gloves, non-powdered gloves, and most of the latex allergy people, they are using the non-powdered gloves, and it's up to the self comfortability and the self. Suppose if I feel comfortable with the powdered one, I can go for that, or otherwise I can go for the non-powdered one. And the now new technology, but it's not the source is less available. So because of that, daily basis you may not get it. But at the same time, if we are working with the chemotherapeutic agents or hazardous drugs, then automatically you have to utilize that particular class only. Okay, and routinely use the barriers. Especially important is the glove is always the important one, eye protection and gown. Okay, and the least one is the head cover and the foot cover. But if we are working in the chemotherapeutic area, then of course that also should be. Okay, and wash hands before and after the procedure, or otherwise after, immediately after the exposure, we have to wash the affected area with the running water. That is the prime treatment. One person, whoever exposed, they have to do immediately as soon as possible. Okay, and after that, precautions they have to do, how they can eliminate the exposure of this type of chemical injuries. And the last one is the procedure and counseling services are readily available. The person or the nurse whoever exposed, immediately they have to go for the on the spot procedures to save that injury or injured area first, and after that next they will go for the counseling services. So because post traumatic stress syndrome is the common one for everyone whoever is exposing. So because of that, counselor is readily available in every area setup, and they can go for that. Next slide, please. Next slide, please. So now let me move on to the anti-neoplastic drugs. Of course, all of you know that this is we are treating for the cancer purpose, but in a contra, we are going to take the cancer whenever we are carelessly handling the anti-neoplastic drugs, because most of the anti-neoplastic drugs are hazardous drugs. Next slide, please. And of course, this is the aerosol products also available, and the drug product tablet format also available, injection format also available, spray format also available. So whatever the format we are using, we have to be very, very careful before touching the drugs. Drugs. So there are a lot of studies proving that spills of hazardous drugs, spills, how the spills occur, most of and the spill occur because readying of the medications, then automatically there are spillage will be there. Once spillage taken place, they are encountered the hazardous drugs, so they are exposing themselves. So exposure, this type of spillage exposure is common. So every nurse must be very, very careful. Of course, we all know this is the life-saving drug for the oncology patients, but not for self, not for the nurse. So we have to be very careful to protect ourselves first, then only we can go for the care. And throughout the care, we have to maintain that protective from ourselves as well as to the patients also. So here, even though some of the nurses, they know very well that there are a lot of health risk is there, but they are careless. Still studies are proving that nurses are careless whenever they are handling the chemotherapeutic drugs. So because of that, next slide, please. So because of that, every nurse should be periodically educated, motivated, instructed how they have to protect themselves and what all are the risks they are going to encounter in a everyday basis. Not only the professional, even their even though their personal life also is going to be affected. So they have to be motivated in a periodical way by the way of training programs, educations, or otherwise motivations. Okay, and apart from that, they can prove and they can go for the to prove something that these all are the way you have to use it. These all are the sources are available. Suppose sources are not available, why it is not available? What all are the reason for that? Provide the exact source to protect the nurses. Then only they are able to wear the exact PPE. Then they can protect themselves. Suppose if the PPE sources are not inadequate or not available in that particular, especially it comes in the government sector only. So in case, then they have to go for the noticing for the supervisor, and they have to arrange everything for that before encountering to the any kind of chemical exposure, especially hazardous drugs. It's a very, very dangerous one. Next slide, please. So every nurse mind that this is our future, our family is there. We have relatives, we have family, we have self-life, and at the same time, we have to do the proper duty in the professional life also. We have to maintain, means then we have to be aware ourselves, careful about ourselves. So some of the here how the spillage may takes place and how much what are the things we have to do. So yeah, whenever we are handling the chemotherapeutic drug, first, we have to observe the safety, precautions, and how we are handling, how we are going to administering, and what all of the things are necessary for that, and whether before touching the hazardous drug, we protected ourselves or not, especially impermeable gown, double gloving, head cover, a shoe cover, and completely the gown should be completely covered with the bag, because sometimes whatever the theoretically we studied, but practically it may not be implemented 100%, but at least every nurse should try to maintain 90% of PPE usage should be there whenever we are exposing with the chemotherapeutic drugs. Next slide, please. So every nurse, this is important aspect. Here you see that one example, just to show the example. Nurse is wearing the gown, but that is the permeable gown, and blouse is okay, but that is not a double to one, and she is without mask, she is handling the patients. So, and in the middle one, you can see that the middle slide, the spillage while loading the drugs, spillage is the common one. So these all are the risk factors are there for every nurse whoever handling the hazardous drugs. So we have to be very, very careful in that. Next slide, please. So whenever we are go for the PPE wearing, now I think that now the awareness of a PPE is almost everyone come to know how to do the donning and doffing of the PPE, because after pandemic, even though before those who were not aware of how to be completely wearing the PPE, now they all aware about, especially in our hospital sector, because of pandemic, and the same is applicable for the chemotherapeutic agents also. So there are some of the 5 points which the occupational. Yes, ma'am.
This is requested to kindly come to the topic fast, because there is time allotted to each and every speaker. So please adhere.
Okay, we can conclude. So there are 5 points which the nurses want to follow to protect themselves. These guidelines given by the government. So they have to go for the safety level of the cytotoxic drugs. Next slide, please, ma'am. So what is the level of the drug, a cytotoxic drug, and how they are going to control, how they can give the education to the staff. Next slide, please. And the PPE protection, how they have to be, and motivation, how they can, and what type of, they have to give some of the guidelines, protocols, everything they have to follow themselves. So I think that I can conclude now. So the conclusion, PPE comes under gloves, gown, full face shield, goggle, 95 respirator, and head and hair cover. These all must whenever we are handling the hazardous drugs. So thank you so much for all of you, and thank you so much for organizers to provide me an opportunity to be in this platform. Thank you once again.
Thank you, ma'am. I would like to thank all both the speaker, Mr. Jitin Paul. He has spoken on the topic that is occupational health of nurses, mental health dimension, and Mrs. Anjali Devi. She spoke on the topic that is chemical injuries, including chemotherapeutic injuries. So now the session is open for the discussion. The participants have any questions related to both the topics, they can ask. Yes, from the participant side, if you want to ask any question, any query you are having, so you can ask from the speakers. Any questions? Okay, so both nicely presented the topic. Regarding the mental health dimension, sir told about the 34% majority nurses have the chance of occupational nurses, and out of that 34, they have 22% chance of psychological impact while taking care of the patient in their clinical setting. And he told about what are the causes of the psychological impact while taking care of patient, and what all the management need to be required to reduce the psychological impact while taking care of the patient. So I think in both the topics, we are like nurses, they are doing very dedication. They don't bother about their timing, don't bother about their physical health, and they are also not getting the support from the organization also. So I think we should constitute a committee. So by these committees, we can emphasize the topics, or we can emphasize the problems the nurses facing while taking care of the patient. Okay, and these the minutes we can put in front of higher authority, so we can resolve the problem related to related to the mental health dimension, or related to the chemical injuries which can facing by the staff nurses while taking care of the patient. Thank you, both the speakers. You have presented very well. Okay.
Thank you so much, Shabana ma'am, for moderating both the sessions. Awareness means understanding that workplace violence can impact anyone in any work setting and across all levels of employment. So today, for the topic occupational health of nurse, workplace violence, I would invite upon the dais the very cool and calm nursing superintendent of SGPGIMS, Mrs. Usha Takri ma'am, as a moderator for this topic. And to present the topic, I would like to call upon Mrs. Kavija Joshua, Senior RN, MSN, Pediatric Emergency Department, Ipswich Hospital, United Kingdom.
Hello, can you see the slides?
Yes, ma'am, it's visible.
Okay, thank you. Actually, first of all, I would like to thank the team for inviting me for this presentation. So as you know, my topic is workplace violence. Yeah. So workplace violence, actually, first thing, this regarding this topic, it's not a theoretical or intellectual topic. This is just the thing which all the nurses needs to be aware of. So first thing the nurses needs to keep in mind is it's not part of our job. As a nurse, we are not supposed to be like tolerating all the workplace violences which we are facing. So we need to know like what is the definition of workplace violence. if we need to resist all these things. So the definition of workplace violence is: workplace violence is an incident where a member of healthcare staff is abused, threatened, or assaulted in circumstances relating to their work, including commuting to and from the work, and which involves an explicit or implicit challenge to their safety and well-being. So all of us are thinking like workplace violence is only happening in the units or in the wards, but it's not the case, because sometimes the incidents may happen inside the units and the nurses or the healthcare professionals are attacked outside the units also. So all these things are included in workplace violence. So the sad thing is that every day I heard of workplace, every day when I head off to workplace, I worry that I will end up in hospital. If someone of you are worrying regarding the workplace violence like this, you have to put your hands up and let your colleagues or let your supervisors or superiors know regarding that. 1 in 4 nurses has been physically assaulted at work. So do you think it's okay? Especially in the country where I am working, it's like completely not okay to be like assaulted, even verbally, or if it's related to color, race, or whatever, it's not accepted. So we have to like put our hands up and come forward to prevent the workplace violences. So we need to know like what is the extent of the problem, because sometimes whatever we are encountering, we think like it's usual for all of us, and we will be the day will go off like a regular thing. So from 2016 to 2020, according to CDC, there were 207 deaths due to violence in the workplace in the healthcare and social assistance industry within the private sector. So it's only the calculations by CDC from the private sector. So we can find like the magnitude of the problem is really, really high. 207, it's not mentioning 207 assaults, it's deaths. So in India, violence against healthcare workers has been ironically has been chronic, systemic, and growing problem over the past decades. So this workplace violence is not started from today. It's over the decades. The thing is like going, but I'm not sure why it's not like controllable. Or sometimes if the workplace violence is happening also, we may not be noticing because we are in busy shifts and we will be thinking like it's part of our life, and we are not like thinking it's a workplace violence. Next is the facts. The facts is healthcare workers are 4 times more likely to be assaulted than other professionals in the general workplace, because we are always dealing with so many people, including the patients who are sick. So they will be like mentally depressed or emotionally compromised. And we will be dealing with the bystanders or those who are accompanying the patients, who will also be in so many problems. So always the healthcare professionals are like more likely to be assaulted or more likely to be attacked, along with the junior doctors. In government hospitals, likely to be more at risk. So working in an emergency department, intensive care unit, or isolated areas also seems to put the healthcare workers at risk, especially during morning outpatient hours and late night shifts. Why this fact is very important is when we are working during these shifts or when we are working in these areas where the patients are more critically ill, nurses also needs to be more careful. We have to be more alert, and when we are communicating, we need to be more cognitively and emotionally dealing the patients and the bystanders. Next, we can see the key factors. Key factors which leads to workplace assault or workplace problems are miscommunication between the healthcare workers and patients and their visitors. So mostly the workplace violence is in the form of assault or verbal abuse, or sometimes it's physical abuse also. So this can occur sometimes because of the miscommunication, because the patient is knowing what's happening with them, or the bystanders is also not knowing what's happening with them. So this can lead to workplace violences. So always try to communicate or take help from someone who can communicate, because I know where I am working is completely different from what is the setting in India. So dissatisfaction with care. So this can completely lead to like workplace violence. And if they are dissatisfied and the patient's condition is deteriorating, the chance for assault or violence is more. Next is delayed medical provision. This occurs mostly in accident and emergency casualty department, because sometimes the patients will be brought and so many patients will be there, and we will be triaging the patients mostly. But the patients don't know they are triaged and they are in which category. So they think like we are delaying the care, but we will be having more important patients to be like cared. So this is a problem which happens mostly. And violation of visiting hours. So if we say someone like, oh, this is not the time for you to visit, then most of the bystanders, they don't like, or the patients, they don't like, uh, some sort of revenge or something will build up in their mind, and it will be causing to violence. And the psychological stress of a patient's family member. So when we are considering patient's family members, when someone is getting sick in their family, they can't go for jobs sometimes, and there will be financial problems. So they will be in psychological stress, and a small impulse can cause them to burst out. And the other is denial of hospital admissions. And the last one is the sudden demise of patients. So if someone is not expected, or someone comes to hospital really healthy, and quickly if something happens to them, it can lead to violence or impulsive behavior from the family. And type of workplace violences. So first one is assault by criminals. So we know, like sometimes the criminals, the gang people, or someone is entering, it can lead to like assault to healthcare professionals, or sometimes someone can assault the nurses or doctors for the drugs which they are craving for. So clients on worker violence. So sometimes the patients will be attacking the nurses or worker to worker. So it's like the in between the colleagues. Sometimes it may be the race, or it can be sexual assault, or it can be like the words which is putting other person down. So when we think like violence, we think only like attacking someone or using our hands or feet to kick someone, but it's not the case. If we are trying, or for example, if a pregnant lady is there, and if she is due for a promotion, and it's because of her pregnancy, if something is like delayed for her, it can also become it will be also coming under workplace violence. And another thing is domestic violence. It's also like sometimes the staffs will be coming for duty, and there will be some problem within their family, and their family members or someone will be coming and attacking them. These all comes under workplace violences. So next we can see how to reduce workplace violence. So the main thing is establish education and training program, because we all know like workplace violence is there. But the thing is, we need to know like how to encounter these workplace violence. So more training programs like this will be helpful for the staffs to put their hands up. And some of the new staffs, maybe they don't know like which are the workplace violences. They couldn't distinguish between what's happening, and put reporting policies and procedures in place. So I'm not sure about the condition, what's happening currently in India regarding the policies and procedures, but we have strict policies and procedures regarding the workplace violences, and we have right to deny care if someone is abusing us. Even the bystanders or the patient is abusing us, we can report that and we can deny the care for them. I can tell I'm not happy to care this patient, but I'm not sure about the condition there. And reduce the normalization of workplace violence. So sometimes we hear like, okay, this is normal for a nurse, or this is part of my life. No, it's not part of our life, because we are working under a lot of pressure. Sometimes we will be short of staff, and sometimes the patient's care acuity will be more, but we will be like struggling to finish the cares for the patient. So we are under a lot of pressure, and upon that, a word of appreciation will be helping us. But if you are not getting the appreciation, that's fine. instead, if we are getting some attack or something, we will be like undergoing depression, stress, and so many things, and it can affect even our professional life. So don't normalize our workplace violence like it's okay. No, it's not okay. And safety devices such as security cameras, and sometimes some call bells or some codes for calling the security when someone is attacking us will be helpful, because sometimes there are instances occurred years before. Someone attacked a nurse in the storeroom. So sometimes in the storeroom and all, proper lighting is really, really important, because night shifts and all, if you're going to storeroom, if corridors are dark, and the security cameras can't even pick up what's happening. So always all the corridors must be light up. And if some lights are not working, it's take it as our responsibility, because our colleague will be coming for night shift. So let's report that and try to like settle all those things. So these are the things we can do to like reduce workplace violence, and awareness is the main thing we can keep in our mind. Next is legal aspects. Truly speaking, regarding the legal aspects, what's going in India, I have gone through only the Google, because I'm not updated with the legal things now. India adopted the Medicare Service Persons and Medicare Service Institutions Act that punishes violent people in the healthcare setting. But it's mentioned that 4 states and 5 union territories in India still have no law to tackle violence against healthcare workers. But even where the legislation is in place, it's been reported that fewer than 10% of cases logged under this act reaches the courts after charges are filed. So it's really sad to know, like, even if it's reported, the charges are not filed. So I'm not sure what's happening. So there must be strict legislation. If there is strict legislation, people will think twice before they do something. And action to be taken by the hospitals. Infographics shunning violence. So in the hallways or wherever there is reception or whatever, just keep the posters like we are less or zero tolerance for violence. And we can just keep the common things which we are trying to communicate, even in emergency, or the infographics for visiting times. So they will not be confused with the visiting time. So if they so many things are displayed there, the nurses need not be talking to the bystanders lot regarding all those things or argue with them. We can just point the posters there and tell, like, this is the policy here. And proper alarm system, if something is happening, like how we are going to call the security or how we are going to call for help. And improved security, strict weapons prohibition. I'm not sure how possible it is to prohibit weapons which is to be taken to the hospital, but if they don't have weapons, when they are provoked, they don't have something to attack someone. And grievance cells to lodge disputes. So if they have something to tell regarding the death of their loved ones or something, they can approach grievance cell. Limiting the number of visitors, counseling for bereaved families. So definitely loss is really a loss. But the thing is, if they are attacking or if they are violent, nothing is going to change. So if there is a counseling cell for bereaved families, maybe it will be helpful. And for nurses, it's very important to have some mock drill training. So nurses knows like how they have to act. So what we are doing is, quickly someone will be coming and they act like they are, we think they are strangers, but they will be coming and they will be trying to attack us. So quickly, how we are acting. So we knows like this thing, this is a thing first I have to do. So try to do like mock drills and all. And these are the tips for the nurses. So this is the important part for nurses. Remove yourself from the situation. So when we are in a situation and if you feel like someone is going to attack or someone's mood is changing, keep a distance from them, because our life is really, really important and we have a family to take care of. but they are also emotionally compromised, means there is no point in arguing with them, or there is no point in talking with them and trying to make them understand. Just remove yourself, or put your steps back when such situations arise, and create a distance. That's the main important thing. So, or just see like, yeah, this is a place I can run backward. So create a distance with the person who is upset, and defend yourself. Report the incident if something is happening. So for example, if a small incident is also happening, means try to report through the system which is in your hospital, and use the strategies to diffuse the situation. So first thing, what I feel is silence, because they are upset if they lose someone, or they are in lots of problem. So if we are arguing, rather than arguing, try to listen to them for some time, or try to like neutralize the situation. And you can get support from the superiors, because you are not able to stay with the bystanders or patients long time, or you are not able to stay with them because it will compromise the care of other patients. So you can get the support from the superiors to negotiate with them, and attend de-escalation training, how you are going to calm them down. So it will come, because when we are considering the nurses also, we will be in lot of stress. So if something is like sparking, it's easy for us to burn and patients to burn, or burn means it's emotionally, it's like a bomb, it will burst out. So professional training to deliver bad news, that's another thing. How to tell the patients, like how to deliver the bad news to them, even if it's a disease or a chronic disease or a death, or how we are going to deliver to them. Because sometimes the patients will be coming really healthy, and the sudden death or something occurred due to embolism. But when they hear the death, they can't accept it like that. So always be calm and use the techniques to deliver the bad news, and don't go and deliver the bad news alone. That's the first thing. Because if you know the family really very well, then that's fine. Or someone who is like expecting the bad news, that's also like a different reaction from them. But if they are not expecting something and we are going, then keep a distance and deliver the bad news. So these all are the tips for the nurses. And always the worker to worker abuse. So don't try to like tolerate. At least tell on their face, like, this is not the way to behave with me, or this is not the way to deal with me. And you have to raise it to the authorities, because if we raise it to the authorities only, this will not happen to other person. Because something happens, everyone will know, yeah, this happened. So it will not happen otherwise. So this is the end of my topic. So no tolerance for violence, silent no more. Please, please, silent no more. Because this, I know this is not an intellectual topic, and all of you know. So I just want to motivate you. If you are facing violence in your workplace, the next day you will not feel to come for work. That's the first thing. You will feel sick, and the number of sick leaves will be increasing if your mind is not great. So always, if you're facing something, you all are brave, we all are brave. So just stood up, put your hands up and say like, I'm not okay, this is not the way I want me to be dealt with, because I'm dealing you with respect, deal me with respect. So thank you all. If you have anything, please ask me now, because it's early morning here. I have to take my son to school, so I want to leave the session. So once again, thank you for the team for letting me to present this topic. So hope the topic is helpful.
Thank you so much, Mrs. Kavija Joshua, for wonderful presenting the topic.
Thank you, ma'am.
Any kind of queries, audience, please
Feel free to ask.
feel free to ask. No question?
Thank you so much.
Okay, thank you so much.
Thank you so much, Usha ma'am, and thank you so much, Mrs. Kavija Joshua, for your wonderful presentation. As we know, the study conducted in a tertiary care hospital in New Delhi showed 79.5% of healthcare workers have reported to have one or more of the needle stick injuries in their career. So needle stick injury is one of the most important topics that we have here. Our topic is occupational health of nurse, needle stick injury, and associated contagious infections. To moderate this session, I would call upon the very diligent and sincere Mrs. Ritija Singh, DNS SGPGI MS. And to present the topic, I would like to call upon Mrs. Gracie M, HIC in charge, General Hospital, Alleppey, Kerala from India.
Good morning. Good morning, everyone.
Good morning.
First of all, I would like to give a words of thanks because this prestigious organization who invite me to participate and orate on this prestigious platform. Let us talk about health. For a better world of people with a good physical and mental health, we need prestigious healthcare facilities, good healthcare facilities. We health professionals, we are the pillars of that healthcare system. So we should maintain a good physical and mental health to provide care to the needy population, sick population. So as the nurses, we should keep good health. As we all know, we are in the midst of a lot of contagious disease in our working situation. But it can be preventable if we follow correct infection prevention control policies and procedures. We all know in the recent years, we are in the midst of a pandemic, COVID-19. And we played it a good role in that to reduce the infection. Now, also we are in the midst of, we are living with this COVID-19 pandemic. Now, at this time, I pray for the souls of who departed to the heaven with the COVID-19 disease. Now, let us talk about management of needlestick injury. I think we professionals, we all are very familiar to this topic. So it's not, it is not a teaching time. It's like a light refreshment only. Yes, we all know about needlestick injury. I have some problem with my slides. So I will explain everything as much as I can. And Mr. Digil, he will share my slides from there. First of all, we can see what is needlestick injury and other sharp injury. Before going to my topic, first I want to introduce myself. I'm Gracie. Already my delegate introduced me, but I want to tell one thing. My name is Gracie Justin. I belong to Kerala. I have been working as senior nursing officer, trainer, and ICN in the Department of Health Services. That is, I'm working in the government hospitals of Kerala. So I'm so happy to invite me to this wonderful stage. Okay, we can see the needlestick injury and needlestick injury and sharp injuries. Common occupational hazards. These are the common occupational hazards which occurs when sharp instruments such as contaminated needles and sharp materials which penetrate accidentally into our skin. HIV, hepatitis B, hepatitis C are the common contagious disease which occurs as a health hazards through needle stick injury. Then we can see what are the risk factors of needle stick injury. First one, non-availability of safety engineered shafts or its improper use. I will explain later in the management. Then improper handling of body fluids, recapping of contaminated needles, failure of disposal of contaminated shafts properly in the puncture-proof containers, absence or improper use of PPE, accidental exposure to blood and body fluids to our body, especially in the mucous membrane. Now we can see what are the preventive aspect of this needle stick injury. When I talk about the risk factors, we see some points. In preventive aspect, we should keep some points. Proper hand washing before and every procedure is very much important. It is the key word of infection prevention control. Then, when we talk about the preventive aspect, use safety engineered shafts, and the staffs or the people who work in the healthcare setup should be aware that how to use it. That is, competency must be needed to use the equipment. Next one, avoid recapping of contaminated needle. Actually, this is a time to get needle stick injury very soon. It should be avoided at any cost. Then only we can reduce needle stick injury to a greater extent. Then proper use of contaminated needles and shafts. Proper disposal of contaminated needles and shafts. It should be segregated and disposed properly in the assigned area in the assigned containers. Biomedical waste should be segregated and disposed in properly as color-coded bag. It is very important that when we talk about biomedical waste, it is a responsibility of the person who generate the waste must segregate the waste, not dispose them. For example, when I do one injection, I am responsible to segregate the waste of that injection. And I don't ask anybody to segregate that contaminated articles after my procedure. It is very important. And the disposal, maybe we can ask to somebody to help us, like nursing assistant or any other people who assign for that. But the segregation of waste is very much important. The person who generate that waste. Another important measure is that proper training is essential for all people who work in our healthcare sector, because training is the key point which eliminates all types of defaults from our situation. So training. It is a must. It is very important. When we are
taking care of Needlestick injury. Then hepatitis C is only 3 to 10%, and HIV is only 0.3 to 0.4%. But due to the social stigma of HIV, all people are very vulnerable, very fearful about the HIV. Actually, it is more, this hepatitis B is more fatal than HIV, because this HIV has a long incubation period, more than within 10 years, and we will get enough time to manage our life, and we will get enough time to plan our life according this with this year. But this hepatitis B is more fatal. If it can spoil our life very soon, and it is the main cause of cancer liver in the world. So due to the social stigma, we all are going on this HIV, but it's the hepatitis B is very fatal. Then management of Needlestick injury. When we talk about the management of Needlestick injury, we have some don'ts and do's. So first of all, we can see what are the don'ts of management of Needlestick injury. Don'ts: do not panic. It is very important when we get an injury with contagious needle, contaminated needle. Don't get panic, because if we get panic, we cannot know how to act that situation. So be calm and quiet. Be calm to that situation. Then only we can do anything. Then next point is, do not squeeze or suck the wound, because if you squeeze or suck the wound, it will speed up the entry of virus into our body. Next one, do not use bleach, alcohol, or betadine or any other antiseptic while doing the cleaning. Then what about do's? Wash hands thoroughly with soap and water, especially under running water. Report to immediate supervisor and CMO, that is casualty medical officer. It is very important that to report these events properly. Research shows that most of the cases are not reported properly due to a variety of reasons, due to some stigma or fear or anything. Most of the cases are not reporting properly. So actually, that is why we cannot get a real picture of this, picture of the account of Needlestick injury. Next one, an entry is made in the Needlestick injury register, which we keep in the casualty or ICU room as per the hospital's policy. It should be written in patient identification and victim's identification, and it should be written very neatly and accurately. Then we have to do blood work of both victim and the source if we know. The blood workers are HIV, hepatitis B, hepatitis C. Post-exposure treatment, that is PEP, should be start as soon as possible, preferably within 2 hours, and should not be exceeded more than 72 hours. It is very important. And PEP is not needed for all cases. It depends on the degree of exposure and or HIV status of the source. But it is very important that PEP should be started at once if the source is not known and the source is on ART or at HbA1c positive. This treatment modality will decide according to the exposure and according to the instruction of CMOs and other preventive medicine departments. When we go through the blood workup, the victim's hepatitis B status and the body status is not less than 10 milli international units per ml, that person should go for PEP of hepatitis B. We can get immunity for hepatitis B in two ways. We can receive hepatitis B immunoglobulin, along with we can take immunization vaccine also. Hepatitis B immunoglobulin should take 0 and 1 month, and it should be taken within 2 hours of exposure. And the next dose we can take after 1 month. Hepatitis B vaccination 0 to 0, 1, and 6 months. This is only applicable if victim's blood level is less than, antibody titer level is less than 10 milli international units per ml. And the PEP for HIV is very important. We should take PEP for HIV if the source is unknown and the source is on ART, antiretroviral treatment. So we should take medication at once. Then it is very important for this procedure, that is counseling. Every counseling should be done before HIV testing for the victim and source also. And if it is positive for any of the viral disease like HIV, HPSAG, especially HIV, we should, I'm talking about the source. The source is positive. When after the test, lab test, we came to know that this this source is positive for HIV. So we have to give medication to the victim, that is our healthcare person. So we should be very careful to give counseling to the victim before starting PEP, because this PEP for HIV is very nasty drug. Actually, it is act on cell cycle. So alopecia and eye is very common in most of the cases. And also, it can damage our liver. And there is a psychological problem, upset behind this procedure. So we have to counsel the victim in a very nice way before starting the medication. And we could definitely take care of her. But in our place, before we are getting leave for the duration of PEP, but it is not now. It is taken up from our room. So we are not getting proper leave during this period. If you want to take leave, we will take our leave from our account only. Otherwise, before we will get 15 days special cash leave for the completion of treatments. Anyway, counseling is very much important. After the completion of PEP, we have to follow laboratory tests. Post PEP HIV, we should do HIV test at 3 months and 6 months. If it is negative in sixth month, then no need to go for further testing. Same like HbSAg, we should test 1.5 months, after 1.5 months, 3 months, and 6 months. After 6 months, this HbSAg is negative. No need to test again for this particular case.
Hello.
Yes,
Excuse me, Grishi ma'am, actually we have less time, so please just do fast.
Okay, I will. And care should be taken to avoid situation which causes exposure of splash of fluid into the direct mucosal region. So we have to wear proper PPE while doing all procedures, and we should stick on the infection prevention control procedures and policies. So once again, I'm telling my gratitude towards you to invite me to be an orator in this procedures platform. Thank you once again. Have a nice day.
Okay, thank you so much. Thank you so much, Grishi ma'am. Actually, you have delivered a very valuable topic. It's a very necessary to everyone to just do proper waste management and generate just waste management properly, so we can save ourselves for NSI. And it's a very nice. Thank you so much.
Any queries from the participants or the audience? You feel free to ask. Any queries from the audience? Please feel free to ask. Okay, thank you so much. Thank you, Ritija ma'am, for moderating this session. Thank you so much. As the healthcare environment, we know that with its packed work days, demanding pace, time pressures, and emotional intensity really lead to work burnouts. So to enlighten our minds with the topic, occupational health of nurse, promoting self-care and preventing burnout, here we have with us the encouraging and motivating Mrs. Alka Mohan ma'am, ANS SGPGIMS as a moderator. And to present the topic, we have with us an ex-employee of SGPGIMS, Mrs. Rachel Ann George, RN, Southeastern Hospital, Melbourne, Victoria, Australia. Rachel ma'am, it's not audible. You have to unmute yourself.
Can you hear me now? Hello?
Yeah, sure.
Yeah. Hello, everyone. Hope everyone is doing fine. Because of the time shortage, I will be really quick with my topic. As you can see on the screen, my topic is stress and burnout management. So, just a minute. Is it important to talk about stress in nursing? No profession is stress-free because now with the pandemic, the stress is increasing day by day. So it's really important to know what is stress and its effect and what it can ultimately cause. It ultimately causes burnout. So we will directly go to see the statistics also says that now that the stress is among the most common workplace hazards for the nurses. Can you define stress? Stress is something that is that happens when there is an imbalance between the demands placed on us, and we don't have enough resources to cope up with it, and it affects us physically and emotionally as well. And burnout happens when we face stress in a routine in our routine day-to-day work, and we don't take care of ourselves. So it is really important to take care of ourselves. If we don't take care of ourselves, we can't take care of our patients. We'll see about the dangers of the nursing burnout. It affects the nurses, the employers, and the patients. The nurses are at a risk of getting depressive disorders, mental health disorders, and they can ultimately end up quitting their job as well. The institutions, their reputation is on the line because the patients will not get good quality nursing care. And major risk is for the patient because it impacts their life as well. Mistakes that happen due to exhaustion leads to infection, and in extreme cases, it can even lead to death. So we can see on the screen there are multiple signs and symptoms that we face when we face stress and burnout. So it can be increased pulse rate, increased blood pressure. Sometimes some of them perspire, and they can have dry mouth. So it varies in the signs and symptoms varies in different patients. So it is really important to know how to prevent this stress and how we can prevent the burnout. So it is possible to prevent nurse from getting burnout and to treat it immediately when it happens. So the first and foremost thing is to create harmony in teamwork. The harmony in teamwork, it involves the administration, the in charge, and the nurses. The administration should listen to the staff. Whenever there comes a problem, they should immediately respond to it. And they should also see that they should also believe that the staff they need their support. Next comes the in charge. It is impossible to create a stress-free environment in a patient in hospitals, but we should, like as in charge, they should try their best to reduce the stresses in the workplace environment. And if they should escalate any problems that comes up to them so that there can be a solution. They can hold team meetings with the colleagues, with the staff, and to identify the stressors that are in the environment and create a solution for that. And also to respect all the colleagues. Next comes the nurses. The nurses, they should maintain a proper communication system, because as nurses, we know that we should have a proper communication system that prevents most of the problems, and in turn, it will lead to decrease in the stress. And also, as nurses, sometimes we are so sympathetic and compassionate. We try to tell yes, even if we can't take up the job. So whenever possible, tell no, because see, sometimes it's okay to tell no because we have to take care of ourselves. And to some extent, one other thing is to have knowledge in the work area, because if we have knowledge of what we are doing, it to some extent it reduces anxiety. Next comes to inculcate some coping skills. So when we face these stresses, the stress in our working environment, we can do some of these techniques that are mentioned on the screen. First one is breathing technique, like deep breathing technique, where you can just take, if you're facing something like that, take a minute break off, go to your room and take a deep breathing, do deep breathing exercise. You can go through and browse through the net. You can see how it is done. It's really simple. And it has great effects, because when you do the deep breathing exercises, it brings oxygen to your brain, and it also helps in decreasing your pulse rate and your blood pressure, and it calms you down. The next thing is to involve exercises in your daily routine. You can do it before or after work because it has a long lasting effect. You can do it even in your day off because it plays a major role in decreasing the cortisol levels, the adrenaline levels, and also it leads to ultimately decrease in your stress as well. So even it's really important to do exercises. Nowadays, it has become a trend. So just get into a routine schedule of doing some exercises. If that's not possible, then at least 30 minutes walk. Studies have shown that just a 30 minutes walk can also boost your immune system. Then comes we have to eat healthy. When we are face to face with any stress environment, here what most of the nurses do is they stick to some caffeinated drinks, tea, and sometimes most of the nurses here, they smoke. So it directly has a bad impact on your health. So we have to tend to eat some antioxidants, the food that contains antioxidants, because that plays a major role in reducing your boosting your immunity system. That you can include some fruits and vegetables and some plant-based foods that are rich in antioxidants. You can include some citrus fruits, broccoli, blueberries, spinach, turmeric, green tea, and all these things contain antioxidants, and it can, to some extent, it can boost your immunity. The next very important one is hydrate yourself. As you all know, the importance of drinking water, as it keeps your temperature normal and it lubricates your joints. And it also helps in getting rid of the waste products. So it's really important to hydrate yourself. So in workplace, wherever possible, carry a bottle of water with you. And the one other thing is to strive for quality sleep, because nurses tend to work in some unusual, weird hours. So it is important to get a good quality sleep, because during that sleep, our body tends to do some restorative work and heals our body. So it's important to get a good quality sleep. Next comes a very interesting way to reduce the burnout is to find a hobby. Instead of going and browsing through the internet and Instagramming, it's better to find a hobby. It can be reading, writing, it can be journaling, and do something that after you have done it, you can feel pride and accomplishment. The next one is to take breaks. It can be a short break during your work shift, like 15 or 30 minutes break according to your work shift. Either or annually you should or must take vacation breaks, because going to that same environment each and every day, you need to have a change in the scenery so that you can relax yourself. So it should become a must to take annual vacations. And the last one, it's really important to seek help, because if the above techniques don't work for you, and day by day the working becomes hard for you, it is very important to seek for help. There are counselors out there. Some of the organizations have assistance group where you can just tell your problems, and it will help you in decreasing your stress. It is not a shame to speak out that you are facing this and you are in stress, because it will help you to come out of that situation. Hope these are the topics, the main topics I have covered to reduce the stress and burnout. And hopefully you all can inculcate these coping skills. Hope you understood my topic. Thank you all once again for inviting me to this webinar. It's my pleasure. Thank you. If you have any questions, you can let me know.
Thank you so much,
Rachel. Thank you.
Thank you so much, Rachel ma'am, and thank you so much, Alka ma'am, for moderating this session. No one heals himself by wounding others, as said by Saint Ambrose. So stop being bullied and stop bullying. So the next topic is occupational health of nurse, bullying and other stressors in the workplace and its management. To moderate this session, here I would like to call upon Usha Takri ma'am, NS SGPGIMS. And to present the topic, I would like to call upon Ms. Yangchen Dolma.
Good
Quality
afternoon,
nurse,
everyone. Yeah. Okay. Go ahead, ma'am.
Yeah, I would just like to introduce a few points about ma'am especially. She's a mentor and assessor for the Lakshya and Kayakal, chairperson for nursing service in TNAI Delhi board for the present year, current year 2020 to 24. And she's a NQA's external assessor for Government of India. Thank you so much, ma'am, for coming here and presenting your topic.
Thank you so much, ma'am, and thank you so much to the organizing team for giving me this opportunity. Warm greetings to everyone for the International Nurses Day. I hope I'm audible.
Yes, ma'am.
Yes. So taking up the topic, occupational health and safety is very important, which we usually ignore. So I congratulate the organizing team for taking up this topic on this auspicious day. So without much wasting time, I will start my topic, bullying and other stresses in workplace and its management. First, we'll try to understand what does workplace bullying means. So I have taken a very comprehensive definition by Health and Safety Authority Ireland, which I found it to be apt. So it says it is repeated inappropriate behavior, direct or indirect, whether verbal, physical, or otherwise, conducted by one or more person against another or others at the place of work or in the course of employment, which could reasonably be regarded as undermining the individual's right to dignity at work. So you see here, to call it as a bullying, the act should be repeated and inappropriate behavior. It could be a direct confrontation or indirect, or it could be in the verbal, physical, or psychological way. And it could be one person to another person, or one person to a cohort of person, or a cohort of a group of people to one person. So it could be any ways. But here in the definition, in the last line, it is said an isolated incident of the behavior described in this definition may be an affront to dignity at work, but as a once-off incident is not considered to be bullying. So if such criteria of situation is happening for once in the workplace, then you won't call it bullying. It could be affront to dignity at work, but it won't be called bullying. For using this word bullying, the act or the situation should be repeated and the behavior should be inappropriate. So I hope everyone is clear with the definition of workplace bullying. Now next, coming to some of the data we'll talk about is India Today in December 2020 reports that around 55% of Indians employees are bullied at work. This is in general, not nursing. And in nursing, there are many studies which says, one of the studies from South India says that nearly 27% of the nurses have either faced bullying or they have witnessed other co-workers getting bullied. So the magnitude is high, and also reports from Nursing Administration Quarterly shows 34% of nurses leave their job or consider leaving the job because of bullying. And Journal of Occupational Health also reports in a study that 25% of registered nurses report physical abuse by patient or their family, while more than 50% of the nurses have reported exposure to verbal abuse. So you see, the magnitude is very high of the bullying. Coming to who can be bullied, there is nothing like a specific kind of office or specific kind of profession are getting bullied. Any kind of workplace can have a culture of bullying, whether it be offices, shops, cafes, restaurant, any kind of it, whether it's a private or a government. And if we talk about the nursing department, any area of hospital where nurses are working, any area can have people who are getting bullied. And now, when we talk about who can be bullied, anyone, that to anyone, volunteers, interns, trainees, contractual staff, or permanent. It depends upon the individuals who are bullying others. So they are the types of bullying are physical bullying, verbal, cyber bullying, relation bullying, sexual bullying, and prejudiced bullying, that is racial bullying. I have few examples. I'll be very quick because time is like we are getting very late. So not all the examples I'll tell here. So some of the examples or situations where we call it workplace bullying is repeated hurtful remarks. And now remember the definition. When I talk about the examples, these situations have to be repeated, and in the workplace it should happen more than once. Okay, so repeated hurtful remarks or making fun of others, or if you are getting excluded from taking part in
Dolma
certain
ma'am,
activities.
Dolma
Or
ma'am, sorry to interrupt.
yeah,
Madam, your slides are not moving.
is it?
Yes, ma'am.
So you
Your
can
slide.
do it. I'll just why it's so?
Yes, now it is moving. Now it is moving.
No, I have stopped sharing it. Shall I see? 1 minute, huh? Definition आ रहा है?
No, ma'am.
Is it moving? So
It is in the first slide.
Oh. So what you do is you share it. I'll stop sharing. I have stopped sharing. You can share now.
Okay, ma'am.
Are you sharing it?
Yeah, wait a second.
Okay. Yeah, shall I start? So this is the definition, and this is the data overall Indian, 55% of Indians. So ये nurses का data. Next. Next. Yeah, so we have finished with it. Yeah, now I was in this example. Some of the examples which I was giving, where we can call it as bullying. So giving you pointless tasks, if it's your boss or something who is bullying you, then giving you pointless tasks that have nothing to do with your job, or giving you impossible tasks that can't be done in the given time or the resources provided. Then deliberately changing your work hours to make it difficult for you, deliberately holding back informations from you. Then physical bullying, that is pushing, shoving, grabbing in the workplace. Then sometimes people try to humiliate you in a and try to make you do inappropriate things in order to be accepted as a part of team. Next, please. Then targeted practical jokes by a group of people to you or one person every time, uh, doing practical jokes to you, and then being purposely misled about work duties, like incorrect deadlines telling you and unclear directions, continued denial or request for your leave. If it's happening again and again, then you can call it bully. And threat, humiliation, and verbal abuse, of course. Now, these two, monitoring and criticism, they we call it bullying when it is excessive performance monitoring. You have to differentiate between performance monitoring, which is the duty of administrative our supervisors, and between bullying you as a excessive performance monitoring. And if it's happening again and again, you can call it bullying. Otherwise, performance monitoring is a duty of our supervisors. Okay, so we have to differentiate this. And then unjust criticism, positive criticism has to be there, but unjust and harsh criticism can be called as bullying if it's happening again and again. Next, please. And bullying may also be discrimination, like if this already workplace violence may be bataya tha. So like because of your age, sex, race, disability, sexual orientation, and religion, if you are getting discriminated and if it's happening again and again, then you can call it bullying. And bullying and violence can be called as abuse. So physical abuse, sexual abuse, like this. So some types of workplace bullying are criminal offenses, like violence, assault, stalking, sexual harassment. You can report it directly, or if your institute has the policy, then you have to first go to your you have to follow your institute policy, then go for the legal help. Now, what is the effect of bullying is you become very demotivated, and you become less active in your work, you become less confident, and you feel scared or stressed or anxious all the time. And some people also goes under depression. Then your life uh, out of your this workplace also gets affected, like your relationships, family relationships, your friendships, they also can get affected. Then you won't feel like working, coming for work also, and you will feel your tendency to trust people will be decreased, and you feel less confident, and you are not happy with yourself as well as the way you are working, you won't be happy. So these are the effect of workplace bullying if you are facing. Next, please. Severe impact is like physical signs also can be there, headaches, backache, sleep problems, and many other physical problems. And psychological also, like difficulty to concentrate, panic attacks, depression, anxiety, and even at a very high level, suicides are also there. Now, what can be done? First is employer. Now, we need to understand as an employer or the head of the department, you need to understand that it is your legal responsibility that you need to provide a safe workplace. So, for that, in the induction programs and all, you need to raise awareness. Then keep an eye on potential targets and bullies, and adopt a zero tolerance attitude for bullying, workplace bullying. Next, please. Training staff member is very important. Our previous speaker also has Madam Joshua. Yeah, she has also focused on training and providing awareness, policies and procedures also, and zero tolerance to bullying also is very important. Now in the training, what you need to train as a employer or as a healthcare this head of the department, conflict resolution, skills need to be improved of your employees, and in turn what happens, it will develop the self-confidence, communication skill, and team building skills. So indirectly they will help in lessening the bullying activities in your workplace. Next please. Now, as a co-worker, like if you are witnessing somebody getting bullied, what is your responsibility? Offering support is very important. Acting as a witness, if a person wants you to be the witness, then you need to support them, and if possible, ask the bully to stop. Or you can also help by going to the HR with your coworker and do complain, whatever the process is. You can support them in the legal proceeding of the bullying situation as per the institute protocol. And listening is very important. I have put up here a quote also. Listening is often the only thing needed to help someone. So most of the time, some people, psychologically, if somebody is listening, somebody is venting out, has a way to vent out by talking to somebody, it also relieves a lot. So listening to your co-workers who are getting bullied is very important, and it will help a lot in most of the cases. Reporting the incidents is very important. Miss Joshua also has said silent no more. So I'll also say that, and her take home message was silent no more. And this is very important to report incidences which is happening around. So bullying is not acceptable. So if you as a co-worker witnessing somebody getting bullied, please raise concern to the management so that management team realize that there is a problem in the system. And staying close to your coworker. So be with a coworker who is getting bullied. If you can't, confront the bully, so that these bullying activities gets lessened. Because if you are there around with that person, then the bullying activity may not happen. Next, please. Now, for a person who is getting bullied, what he or she needs to know is, first and foremost, is you have the every right to be in a safe workplace. So this is your basic right, that you should be working in a safe workplace. And safe workplace means free from violence, harassment, and bullying. So this is your basic right. And another very important, very, very important psychologically, is that you need to understand that there are things you can do and there are people who can help. So if you have that perception regarding the bullying situation, that people can help you, or there are things which you can do, there are things like solutions for this bullying situation, then only you look for solution, then only you'll go and take help from others. So this 2 point is very important. But first you need to understand that working in a safe workplace is your basic right as an employee. And second is that there are things you can do, and there are people in the organization who can help you. Next, please. So now, if you have that perception, these 2 points I have stated before, then only you will go ahead and look for some solution, right? So for that, first and foremost thing is you need to keep your calm. And uh, most of the time bullies do it for reaction, so you should not react. You should not react whenever there's somebody is bullying you. You should not react in either way, whether it is like you are getting upset or you are laughing. Some people they use their defense mechanism and laugh around when somebody is trying to bully you, right? So both the things you should not do. To the bully, you should not show that you are hurt or upset, or you should not laugh also. Laugh and because then they get if you feel upset and hurt, then they feel victorious. And if you laugh around, they get more angry and they will bully you more. Okay, so these both the reactions you should not give. Then documenting bullying activities should be done. So keep a track of you. If you are not able to do anything, please document what's happening with you. So keep a track of all the bullying actions in writing. Note the date, what happened, when did it happen, at what time it happened, and what actually happened, and who were the people around when this happened. These things you should keep a track. Okay, for bullying to tell, you need to have more than two same, like such situations at a go, like more than two incidences. You, if you have, then only you will call it bullying, right? So that's why documenting all the things is very important. Next, please. And if you have any physical evidences, like if you get a message or a email or any comments on social media, whatever it is, please save it as a physical evidence. So when you are going to report it, it will help you. So if there are documents that can help prove that you are being bullied, and report the bullying. Now, next is when you have those documents, nahi, pehle wala, back. So reporting is very important. So reporting, you should follow the institute policy first, as I have said before also. And if you don't know the institute this policy, then try to talk to your immediate supervisor. If that immediate supervisor is bullying you, then someone higher to it, or your colleagues, you can ask those who are more senior to you, or no, those who have more experience in the workplace. You can ask them what is the process, or you can go to the HR department and ask also. Okay, yeah, next. Confronting the bully is important. When Joshua said silent no more, that means you need to confront the bully, right? So if you know who is bullying you, then bring along a trusted witness like a friend or a co-worker who is willing to help you and who is willing to, be the witness. But when you approach, when you confront the bully, be calm, direct, and polite. Don't react and don't raise your voice. So normally, evidence says that those who bully others possess low self-esteem. They have their own psychological issues, and they have their own background issues, like maybe life experiences or not, because of which they are bullying others. So try to be calm, direct, and polite, and try to confirm the bully, but in front of some witness. And then review work policies, like in your organization, what is the organization policies, like whether they are committees or not. Like, for example, we have our grievance committee in our institute, welfare committee in our institute. And if it's a racial bullying, then we have other, like NGOs or any other organization who is working for that. If it's a woman, because of the gender biasness they are bullying, then you have the women's activists are there. So likewise, you need to see what kind of bully it is, and then which organization or which authority is the best or appropriate way to approach. Next, please. And then we have, now for the nurses, we have the nurses union. So they also can have, welfare committees in the nurses union, and they also take up our grievances. So, and professional associations, lots of professional associations are there these days. So if you are a member, that's why it is very important to become a part of some association of professional bodies. Like in nursing, Trained Nurses Association is the apex of all the professional associations. And in the union, your own hospital union, you should be part of it, so that whenever you have certain grievances, then you can, if you are member of that organization, that union or that association, then only you can approach them, and your representative of that union or the association will be able to offer some guidance or support you how to deal with this bullying. So, and seeking legal guidance is also good, but then legal action may not be always possible. But a lawyer or any legal advice can have, they may have like specific advices for you to, like, how to deal with it. So it is always, if you want it, if the bullying is very, like the degree of bullying is very, severe, then of course you can seek legal guidance as well. Then reaching out is very important, very, very important. Reach out to others, co-workers. As I have already said in my first slide, that there are people who will help, right? There are things you can do. So if you reach out to others for help, then only the doors will open for you to solve the problem. So co-workers may be able to offer you support, and talking to your family members, talking to your friends about bullying can also help. Professional help, if you are psychologically very affected, then you need to explore ways to cope with the effects of bullying. You need to take professional help. And in some of the cases, bullying can also contribute to depression and thoughts of suicide. So in order to prevent these severe level of mental problems, you need to seek help timely, and you need to talk to your colleagues. Don't think that everyone is useless. When problems are more, then you tend to think it's a human tendency that you will find everyone as not of use. But then you need to make up your mind and think. The two very important thing is, first is working in a safe workplace is your basic right. Second is that there are solutions for your problem, and there are people in your organization who will help you. Thank you so much.
Thank you so much for beautifully presenting the topic. Dolma ma'am. Any kind of queries, audience, please feel free to ask. Any question?
I think they are,
No,
yeah, the time is no getting, now it's time for lunch. So maybe everyone is very hungry. So no questions.
Okay.
Thank you so much,
Thank you so
everyone,
much,
for
Dolma
having
ma'am.
me. Yeah. Thank you so much.
So much, ma'am. Now, as we're running short of time, we'll make it a bit quick. So having our next, thank you so much, Usha ma'am, for moderating this session. Next, I would call upon Mrs. Ritija Singh ma'am, TNS SGPGIMS, to moderate the next topic, that is occupational health of nurses, radiation, exposure injuries, and associated illness. To present this topic, I would like to call upon Mr. Sarun Jose, RN perioperative nurse specialist, Queensland Health Ramsay Healthcare from Australia.
Sarun, please unmute yourself.
Sharon, please unmute yourself. आवाज नहीं आ रही. Are you listening? No.
Mr. Sarun Jose, we would request you to unmute yourself.
No.
Okay, no issues. We have some technical problems with our resource person, Sarun Jose. So what we will do is we will go ahead with the next resource person. Now I would like to welcome Professor Nitin sir. He is a assistant professor from the University of Jodhpur AIMS. So he will be, giving us a oration on the musculoskeletal occupational disease, what we all nurses can have, and he will elaborate on those topic and give us some real insight into that. So, Nitin sir, please, over to you, sir. Thank you. Sir, again, the same problem, sir. You have to unmute yourself.
Now. Yes, now I think, yes, am I audible to you?
Yes, sir. Yes, sir. Please go ahead.
Okay. Thank you very much. Yes. Thank you very much. First of all, outside, I would like to thanks to entire organizing team of SGPJ for giving me this opportunity to share and deliver the lectures on very important tasks. So without wasting the time, I would like to share my PPT. Okay, so I hope the PPT is visible now.
Yes.
Yes. Okay. So the topic which assigned to me to speak about that is the occupational health of nurses, musculoskeletal injuries, and the patient handling and mobility standards. So this is one of the very important topic, and the things which has to be done by handling the patient, and there are certain standards which will have to be carried out. I hope my slides are moving also.
Yes.
Okay, thank you very much. So today the key points for the discussion, we are going on certain topics and certain discussion, like we will have first introduction. Then we have the data of American Nurse Association survey for the musculoskeletal disorder. Then we have certain research data or the research evidence. Then the factors, or there are certain risk factors which may cause the injuries of musculoskeletal disorder. there are certain tasks actually which may lead in the general ward as well as in the OT operation theaters or the room, where the people or the staffs those who are working are getting chance to be, to get more injuries, or they have more musculoskeletal injuries. Then we have the national standards. There are certain principles, and the patient handling and mobility standards are there. And we'll see if we follow that all the standards, then what the benefit the nursing staffs will have. So I'm going to talk about this, all the key points on these topics. So occupational health, why we are talking about this, why it is important? Is it really important to talk about occupational health? Yeah, because if you are not safe, then the patient will not be safe. So always you have to think about our health, how we can prevent from the injuries, how we can prevent from musculoskeletal disorders. And once you will be fit, then obviously you can carry your strengthening procedures, the fitness will really prompt others to do the good task, and it will help patient also. So your patient safety is primary, then patient safety. In June 2013, the American Nurses Association has released the Interprofessional National Standards about safe patient handling and movement. Experts from more than 25 professional organizations, business and healthcare system participated in the development of this standard. So initially that was the plan by the American Nurse Association, and they have create or make the standards, and many more organizations were involved in that. And as we are talking, I'm talking about the musculoskeletal disorder. This is a cumulative trauma disorder, those physiological illnesses which may develop over a period of week, month, or even year due prolonged mechanical stress imposed on the musculoskeletal system, resulting in injuries recognized as physical ailment or abdominal condition. So this musculoskeletal disorder, this is not a day one process. Maybe for the longer period, may have strenuous activity, for prolonged mechanical stress, standing for the longer period, and it may cause the injuries. In 2018-19, the United Kingdom lost an estimated 6.9 million work days due to work-related musculoskeletal disorder, accounting for 29% of all days lost. So this survey was done in 2018-19, and they have observed that because of this musculoskeletal disorder, many of the people, they have lost their days, they were not able to join the duties. And one survey was done in Ireland. In Ireland, the Health and Safety Authority has done this survey in 2020, and they have reported that health sector recorded work-related injuries of 21.4%, the highest annual rate of work-related musculoskeletal disorder recorded in date in Ireland. So this is 21.4 is a huge data, where the staffs are, just because of musculoskeletal disorder, they are not able to do their duties, they are leaving their jobs, and many more problems what they are facing. There's a health and safety concern. There's a data which is produced by the American Nurse Associations, and they said there's a disabling musculoskeletal injuries account 62%, and this data are many, many more actually. If we account that 62% people, those who are suffering from musculoskeletal injuries, is a huge number. 52% of nurses complain of chronic pain, back pain. Out of this 62, if we consider which injuries are more, or the musculoskeletal part is more, so 52% nurses are complaining of back pain, 12% leave nursing because of back pain, because they are having severe back pain, they cannot able to sit, they cannot able to stand. Because of this reason, 12% of nurses are leaving the job. So you can understand how much important to prevent this injuries. 20% transfer to different unit because of back pain. Sometimes they'll take transfer because many of they are working in OTs, many they are working in the ICU. So they used to transfer, they take transfer in the OPDs also. So this is the 20% of the number, and back pain is the leading cause of disability, those under age 45. Because as we know, the age is grown, there is a physiological changes will be there. But if compared to the less than 45% of the age, the back pain is the main leading cause behind it. There was a survey, as I told you about this. This is a 62% reported that musculoskeletal disorder, where 56% people say that they experience pain because of musculoskeletal disorder that was exacerbated because of job only. So here the nurses are telling that out of 62%, those who are suffering, 56% because of job only they are having disorder, and out of this 56%, 80% reported pain because of musculoskeletal disorder, but continue to work despite experience the frequent pain. So you can understand after having several pain also, if they are doing their duties, then how much difficult it is. There are chances of error will be more, chances of more injuries will be more. So this data is clearly indicating that the patient handling or the preventing of the nurses from these injuries are very important. One of the papers is published in 2021 only, and they are showing the relationship between musculoskeletal disorder and work performance. And directly it is indicating that the people who are working are having the more and more injuries. They are having correlations, they are positively correlated, and they have shown the data that analyze the relationship between musculoskeletal disorder risk factor, and the score showing the 6 times and 3.25 higher rate, especially those who are working in the clinical site or those who are working in the, as a nursing staff, working to the emergency unit, working to the intensive care unit and general ward. So comparatively, if we go the people, those who are higher at the risk, obviously those who are working in the emergency department and the intensive care are higher compared to the general ward. This is also one paper has been published in 2020, and they were saying it was in Saudi Arabia, work-related musculoskeletal disorder in nurses working in the Kingdom of Saudi Arabia. And they said that out of all the participants, 63.8% indicating that they are having or they experience a discomfort during the last 12 months just because of lower back pain. And 50% were having the shoulder pain, 48.9% were having upper back. So you can understand this data is directly indicating that how many of the nurses are suffering from back pain just because they are not maintaining the body mechanics. They are having any other problem also while lifting and moving of the patients. So nurses who experience pain, what happens if they are experiencing the pain? So they will not be productive or less attentive, because we know that if they are having pain, they cannot stand for the longer time. They cannot, do the certain procedures. They can not stand for the longer time, and they'll not be attentive. But because their focus will be at the pain, because they're having back pain, shoulder pain, so they will be more attentive toward the pain compared to the patient's care. So they'll become less attentive and less productive, more prone to consistently make mistake. As I told you, because if the attention will be deficit and there is no attention while doing the procedures, and because of the pain, so chances of getting errors and mistakes are more susceptible to injury. They can have more injuries because, as I told, because already they are having back pain and again they are doing some strenuous activity, then chances of getting more injuries or pain are higher side. May be more likely to make mistakes that affect the health and safety of patient and co-worker. Because if you are not able to concentrate, if you are not able to do the things on the time and not able to stand, then there are chances of making errors are more, and this error will directly affect to the patients and your co-workers also. Remember to balance, very important, work demand and worker capacity, because as the work demand is increasing, you have to increase your capacity, but same time we have to take care of ourselves. If this balance will be distorted or there is an imbalance in any of the part, either demand is increasing day by day, then you have to do the overactivity, and due to overactivity also you may have back pain, you may have stress or musculoskeletal injury, or if you are reducing or your worker capacities has been reduced, or then also it may causing the problem. So this balance is very important between work demand and work capacity. Factors causing injuries to health. We have multiple factors. So if we'll focus on the factors and if we'll try to stop this, then obviously we can prevent this musculoskeletal injuries, back pain, and everything we can. So first, there is occupational stressor, because staff nurse is working in critical care area, so they have many stress. So they may do some activity in the fast, They have, multiple patients, so they have to go for the one patient, then second patient. So there's a stress will be there. And by doing this, multiple procedures, standing for the longer duties, there are chances of the risk is very high. Plus this factor, if you are going through the stage where you are having like back pain, and you are suddenly, lifting the patient, you are going for the transferring the patients, then again, it precipitate the condition. And there's a pre-existing condition also very similar to this. Work method and training. Because whenever you are working in any of the department, so there are certain guidelines or SOP will be there. There are the trainings is also required. How we have to lift the patient, how we have to give the position to the patient, how we can shift the patient. So the training is required. Where the training is deficient, where the training is not given to the staffs, then chances are very high. Experience makes make a matters here. Because once you will be in the system, you have experience, then you will understand how we have to go through, what kind of training we have to attend, what kind of the paperwork before shifting the patients we have to do. So this will make you understand that the things what we have to follow before preventing the injury or transferring the patient. A certain leisure activity where we will be busy in kind of things and we are not able to focus on the particular procedures, that also make mistakes over here. Then again, the certain causes we will see here. The first one, that an aging nursing workforce. Because as per the survey, one of the survey was telling that 45% of staff nursing are having the age group is more than the 45%. 45% of the nursing staff, the workforce is having more than age of 50. So, as the age is growing, so our capacity has reduced. We cannot have such strength. We cannot do such stressful activity. So sometimes the patients we are shifting, lifting. So if the age is more than 50, then they can't bear that pain. So chances of getting injury is high with the age. So aging is also one of the factors over here. Increase in patient activity and workload. For an example, if you are alone in nurse in the intensive care unit, and you are doing multiple procedure, you are going with one patient, then going to the second patient, then where you are doing something, lifting the procedure. Here also you are, bending your back and everything, and standing for the long time. So workload is increasing. Then obviously the pressure will be higher at the backside, or spinal pressure will be increasing, and it again lead for your neck pain, the shoulder pain, and many more other injuries also. So workload should be as balanced. It should be with the proper ratio. Poor body mechanics. If you don't know the principles of using the body mechanics, then obviously there are chances of getting injuries are higher side. So you have to use the proper body mechanics while lifting the patient, while moving the patient, while shifting the patient. Injuries to the patients. Because if suppose the patients who are getting injured or who is prone to get injured, so while doing or shifting that, we have to be very active, we have to be proactive, and increase in dependent patient. There are certain patients who cannot even sit, who cannot even move, where we require more amount of the force. And if the patient is completely dependent on the nurse for the shifting or moving, where the nurse has to try more and more to even shifting to moving of the patients. So there the energy has to be more prepared for a nurse. Lack of use of lifting equipment. We have multiple equipment, but if there is a lack in the hospital, there is no equipment for lifting the patient. Now we have several equipment to shifting the patient, to lift the patient for the from wheelchair to bed to wheelchair and everywhere. So, but there is no availability of equipment, and then they have to use their manpower. And if the manpower get injured because of the improper body mechanics or lifting the heavy object, so they cannot go for it. So this is also one of
Hi,
the
Nitin.
Yes,
I am just stopping you, please. Time is running short, so please start now.
You can cover fast. Factor causing injuries in nurses. This is also one of the factor, like reaching and lifting load far from the body, because it is not close to body, then chances of getting injuries more. Posture is not of the caregiver. If you are lifting any heavy objects, or the frequency is very high, very frequently you are lifting the object or the patients. If while lifting, if you are twisting yourself, then also you are not maintaining the body mechanics. Moving a lot with a great distance, because always whenever you are moving, it should be very close to your body. Reaching low or high to begin with, it should be at the level of the breast. If it is not, then obviously chances of getting are more. Risk factor like unexpected change during the lift, falling the patient, because you're lifting the patient and suddenly patient gets fall down. That you have to use more force, or you will also bend yourself. So chances of getting injuries are more. Excessive pushing and pulling. If you are doing excess pulling or pushing, that also require more pressure, and chances of injuries are more. Lack of ability to grasp the patient's activity. If there's a certain, we have certain support, certain handles, then easily we can handle the patient, easily we can lift the patient. But if not available, chances are very high. Totally dependent or competitive patient. The patient is very aggressive, very not cooperative. That you require more force to control the patient. So that could be one of the reasons. Special patient like stroke, which cannot be moved. They cannot, even lift the leg also. Here the pressure also required more, and the patient's inability to understand. Because while explaining the patient, you are telling something to the patient which will help you in the lifting or moving, but the patient is not understanding. Then the chances are getting the high. These are certain high risk tasks, like in general, like heavy load, sustained upward position, bending, twisting, reaching is less, you are fatigued, force is required more, or standing for a long period. And for the OT, especially like holding a tractor for long periods of time, lifting and holding the patient activity for a longer period, reaching, lifting and moving equipment for the longer time, repositioning the patients, and standing for long period, transferring patient on or off from the operating room bed. So these all are the tasks which will, for if you do for a longer time, then it may lead for the injuries. These are the certain principles which is given by the safe patient handling and mobility. These are the national standards which has to be followed. Established a culture of the safety. Implementing and sustaining a safe patient handling mobility program has to be done. This program should be explained to the nurses how we have to handle the patient. Incorporating ergonomic design principle to provide a safe environment of the care. Selecting, installing, and maintaining safe patient handling technology. That has to be teach how we have to use the instrument if we have lifting of for the patient. Established a system for education, training, and maintaining competency. We have to educate the nurses and we have to train them how to use it. Integrating patient-centered assessment, care planning technology. We have to assess the patient like what kind of things he required to shift. So that has to be done. Including safe patient handling in reasonable accommodation and post-injury return to the work policy. If any staff is getting injury, then what we have to do, what policy we have to apply, what kind of training we have to give. Established a comprehensive evaluation system. So these all are the principles which has to be followed. Patient handling mobilities and standards are there, like assess the situation, like you should know our limitation. You have to see what kind of equipment we have available for handling and mobility of the patients. Plan ahead and prepare the environment. You have to clear the pathway. The obstacle should not be there. You have to communicate with the staff what kind of things you have to do, how you have to lift the patient, you have to ask for help. You have to do the easy approach, firm approach, gentle touch with chair. You have to surround the joints, one hand on each side of the joint, only range one joint at a time. Full hand control, you have to keep finger together, avoid claw hand because it may causing the bruise. So you have to approach positively, you have to control the joints and completely you have to cover the patients. You have to never push in the restriction area, you should not bounce, you should not move slowly, or you have to move slowly, avoid the jerk movement. Hip and shoulder should be firm and properly it should be held. And if it is not held properly, you should start over. Means you should do it again. Body mechanics, there are certain elements we actually have to remember. Like body should be proper aligned. Center of gravity means all the weight should be at the center part. Base of the support should be there, and body should be well balanced. And for the principle, like assess the environment, plan the move, avoid stretching and twisting, ensure proper body strength. Stand close to the object being moved, then face direction to the move, avoid lifting, work at waist level, reduce the frequency between the surfaces, bend your knees, push the object rather than pull it, and maintain continuous movement. Use assistive device, work with others. So these are all principles you have to follow while using your body mechanics while shifting or moving the patient. Body mechanics already explained, so I'm not going to go to this slide. And you should not do this. You should avoid the quick and jerky movement. It may cause the injury. You should not twist when lifting because it may causing again the injury. You keep nose and toes pointed at the same direction, so there will be no twisting. Wear clothing that interfere with safety. You should not wear the large jewelry, shoe with high heels. That may cause the injuries to the patient. Handling and mobility device. Whatever the instrument or mobility device you are using for the patient, you should know how to operate it. You should know how to use it. The staff should be well trained to use them. And you have to take support from the staffs also regarding how we have to use this mobility equipment. And there is an algorithm for patient handling and movement. There is a specific guideline given. When patient is on bed, how we have to shift from bed to chair, from chair to bed, from chair to toilet. So specific guidelines will be given for this. These are the examples from patient to how we have to do. So there are certain devices which need to be used for that. I'm not going. What the benefit of nursing staff? As I said, if you are using this all the mechanical devices, you are using the body mechanics, then what the benefits to nursing staffs here? Increase the job satisfaction, very important. Because if I'm healthy, if I'm doing all the procedures, if I'm giving satisfaction to client, that satisfaction will be for mine also. So I will also satisfied by this job. Increase morale, because if I'm doing perfectly my job, helping to the patient, it will increase my morale also. Decreasing loss work, because if you are having injury, you will take the leave. Certain you will take the medical leave. So this way you will decrease your working days. So obviously you will decrease your loss work because of this. So always you have to use this all the mechanical. Decrease muscle pain and fatigue, because if you are using this all equipment, body mechanics, it will reduce your pain and fatigue also. Decrease injuries. So these are the benefits to the staffs if they are going through the proper standards of the guideline. They are using proper equipment for lifting the patients. This all about the. Thank you very much for giving me this opportunity. I hope I was a little faster, as just the time was not giving permission me to do more. So once again,
Thank you, Nipin.
Over to you.
Thank you, Nipin. Thank you so much. Very outstanding presentation. And this is the very burning topic for all of us. And it's a very nicely presented by you. Thanks so much.
Thank you. Thank you very much. Thank you.
Thank you so much, Ritija ma'am, and thank you so much, Mr. Nipin Kalal, for the beautiful presentation, which was mostly liked by all, and one of the most important topics required by nursing staff to be known. Next, due to some technical issues, we couldn't have the class earlier. Presentation by Mr. Sarun Jose regarding the topic occupational health of nurses, radiation exposure, injuries, and associated illness. So we'll have it once again. To moderate the program, I would like to call upon Mrs. Alka Mohan ma'am, ANS from SUBGMS. And once again, I would invite Mr. Sarun Jose, Perioperative Nurse Specialist, Queensland Health, Ramsay Healthcare, Australia, to present the topic.
Thank you very much. Can you hear me and see me properly now?
Yeah.
Can you hear me? Yeah.
Yes,
Yes.
we
Okay. I'll jump into the topic. So I'll be discussing about radiation problems and occupational hazards that's caused due to radiation in nurses. So radiation is used in not all departments, but in operating theaters and interventional radiology. And only about 10% of nurses work in those departments. So it's not a common topic that everyone knows about. And to be more specific, I'll say there are two types of radiations. One is ionizing radiation and the other one is non-ionizing radiation. The one we are focusing on is ionizing radiation that includes X-ray and ultraviolet rays, which are harmful for human beings because they have the capacity to break the bond between chemicals. That means it can alter the chemicals in DNA of a human being that can lead to various health problems. So low frequency radiations like radio waves and visible light can't break chemical bonds, only vibrate atoms. These types are referred to as non-ionizing radiations that are not used in hospitals. So why is ionizing radiation harmful? Because ionizing radiation is able to break chemical bond, it's able to damage living tissue. The body can repair limited amount of damage, for instance, like sunburn caused by ultraviolet radiation, but extensive damage or damage caused over time is less easily repaired. Also, some tissue is more sensitive to radiation than other tissues. So how do we make use radiation safer? The level of damage caused depend on the type, intensity, tissue sensitivity, history of exposure, and the amount of scatter generated. to make ionizing radiation procedure like X-ray imaging safer, we therefore factor in length of time of exposure of radiation, distance from the radiation source, that's like a C-arm or a X-ray machine, how sensitive the tissue is. Bone is more sensitive and absorbs radiation than any other tissue in human body. That's why we can see the bones on the X-rays. How much radiation exposure the person has already had and how much shielding is being used while radiation is exposed to the person. Then we can make procedures involved ionizing radiation safer for patients by ensuring healthcare professionals are properly trained and licensed in to use the radiation equipment, limiting X-ray procedures to those required for diagnosis or treatment, ensuring equipment has inbuilt safety features, and observing the recommended dose limit for medical exposure of radiation. And we also make these procedures safer for workers by increasing the distance from the source. So it is considered that staying 2 meters away from the machine, you will not be getting as much of amount of radiation that you will be exposed if you're staying closer. So 2 meters is a recommended distance that a person should stay, like especially nurses. If you can, you have to stay 2 meters away from the machine to avoid the harmful effects of radiation. Then limiting time exposure. So especially in departments like cath lab and interventional radiology, the screening of x-rays are gone for a longer time than quick shots in orthopedics and urology departments. So people who work in cath lab, they should wear proper lead gowns. They should protect their head by wearing lead-coated hats, and they should also wear glasses which have got lead coated. And there is also a new thing called shin protector that protects the shin bones, which no one actually cares about, because all the x-ray gowns that we use currently does not always protect the shin bones, so it is exposed to radiation. And observing the recommended dose limits for occupational exposure to radiation, like the TLC badges, are important to wear for all the people who work in radiology departments, so that we can keep a track on nurses who are exposed to radiation. And if we have to change the department, or if we can reallocate them to some other place where they are not exposed to radiation, then that is one of the way that we can reduce the damage caused by radiation to the nurses. So this is something we are talking about, which we can't see. Radiation is something that we can't see. So, and we can't neglect it if we are careless about it. On a long run, we will have problems associated with like loss of hair. If you are not wearing thyroid protector, you will have thyroid problems because of radiation, and it can lead to fertility issues in both males and females. And if you, it can also lead to cancer, not just cancer, it can lead to brain cancer, and it can also go distributed to different parts of the body. So it is something which is important and it should be taken care of. And all the recommendation is all the nurses should wear proper lead gowns, which are examined yearly to make sure that there are no cracks in the lead gown, because if there are cracks, the x-ray can still penetrate through the cracks and still the person will be receiving x-rays. So the lead gown should be monitored, the radiation received by the nurses should be monitored, and it should be taken into consideration to change the department of nurses who are exposed more to the radiation. And if nurses who are female and they are pregnant, they should try to avoid working in those departments, and they should inform their manager, and they should wear proper lead gowns. If it's not possible, then they should try to not to get involved with those cases or stay away from the theater. So there, it's very important to um, consider protecting yourself from radiation, and it is a very important thing to do that. So I don't have much anything else to say because it's a huge topic. And if you have any questions, just let me know. Um, so I think I've gone through what is radiation and what does it does to your human body and what are the disease conditions that can occur due to radiation and what can be done to prevent radiation. So I think we are pretty much covered. And try and one more thing, if you are doing a hand surgery, especially if you're a nurse in orthopedics, then you should try to avoid bringing your hands in directly under the x-ray machine, so in order to avoid high intensity x-rays delivered to your human body. So I think that's it. Thank you. I think I didn't took too long.
Mr. Sarun, very important presentation for all. Thank you.
Thank you.
Thank you so much, Alka ma'am and Mr. Sarun Jose for the lovely presentation and the quick presentation and wrapping up of the topic. Thank you so much. Now, just information to each and everyone who is viewing this program and are participating in it. A post-test link has been sent through the mail and is also present in the chat box. So please take the pain to fill it up so that we can assess the knowledge that is acquired through this webinar. Now, as we have finally come to the end of the scientific section and also the webinar, I'm wholeheartedly thanking the Almighty and each and everyone present here who in one way or the other has joined us in this program and has contributed their part in successfully completing this program. As it said, feeling gratitude and not expressing it is like wrapping a present and not giving it away. So I take this opportunity to invite upon the very vibrant and dynamic, the one who spreads miles and miles of smile with only her single smile, the one and only Mrs. Usha Takri ma'am, NS of SGP JMS, to deliver the vote of thanks.
Thank you, Krishna. Good afternoon to one and all present here, respected speakers, moderators, and all the participants. It is an honor for me to receive the opportunity to thank all the dignitaries. I extend my gratitude for our honorable chief guest, Professor R.K. Dhiman sir, for taking out time from his busy schedule to grace the event. Sir, thank you for inspiring and encouraging us with your words on this special day. A special thanks to Professor Gaurav Agrawal, CMS, for providing immense support to take the webinar successful. My sincere gratitude to Professor V.K. Paliwal, MSR, and Dr. R. Harshvardhan, HOD of Hospital Administration, for supporting us. My special thanks to Mrs. Laizama Khalib, RCNO, to organize a webinar even in between the pandemic and her busy schedule. I must thank the organizing team, volunteers, for working hard for the past few days to make this webinar successful. I congratulate all the participants for their active participation and imparting their knowledge to us. Once again, I would like wholeheartedly thank everyone on and off screen who in one way or other are a part of successful completion of today's webinar. Thank you so much. Jai Hind.
Thank you so much, Usha ma'am, for delivering such a wonderful vote of thanks. By this, we come to the end of today's webinar. So hearted thanks to all. Hope you all have gained knowledge in one way or the other, and hope you all will impart this knowledge to other people also so that they can also understand the problems that are faced by the nursing staff along with this occupational hazards and the problems and ways to the solutions to face those problems in their present life and the current scenario. Thank you so much.